Welcome back to Open Line. We are talking about the coronavirus, and we have with us the state epidemiologist with the Tennessee Department of Health, Dr. John Dunn. And I'm just going to try and go through as many calls as possible here. We have Reverend Fuzz on the line. Hello, Reverend Fuzz.
Hey, Ben. I'm so happy. This could be the most important help. I've spent half of this day, I promise you, responding to calls from church members really adamant about what should be done in response to this coronavirus. Do we cancel church service? I want to ask Dr. Dunn. We got to help make that decision. I was spending hours and on the phone just when you came on with a lady saying, and Dr. Bailey and Dr. Bill, they are very good friends. I was going to call them, and then I got a good friend, Dr. Wanda Drake, who's an infectious disease physician at Vanderbilt. She's the smartest person in the world. I said, this Dr. Dunn, Mike can just tell me. Our members are older. One member I told her, go get Lysol and let's make sure our health team just wipe down stuff. But even in your press conference today, I'm looking for what do I do? You're saying it's a state of emergency. Do I cancel church services? Several other pastors have asked me the same thing. One pastor was amazing. This member said we need to change the communion containers, and one of my members had said the same thing.
How big is your church, Pastor Fuzz? How many people would be in the congregation potentially?
We'll have on a Sunday, we'll have 100 people on Sunday mornings, and
all right, let's talk about that.
People would be over 50.
Okay.
And I would ask, do we not have service Sunday? Should my service be postponed? And how long should I expect not to have a service? What do you want me to do?
All right. There you go, Reverend Fuzz.
Yeah. Well, Reverend Fuzz has mentioned a great question. And I think we touched on this earlier. One thing I did want, before I address that question, the state of emergency, the governor's announcement today, the governor and the governor's office has been very attuned to the idea that we don't want people to panic. This is something that public health and the medical community have dealt with in the past. We're going to deal with this. We're going to get through it. That language, state of emergency, it just in itself could cause people concern. But what that does, it's enabling us to get more resources and respond more efficiently. So I just want people to understand that state of emergency or executive order is not intended to scare people or make them feel like there's something they have to do emergently. But people
are pretty uneasy. I mean, it's been absolutely a crazy 24, 48 hours.
Yeah.
And so here I have Reverend Fuzz, 100 people will be there on Sunday, and I know there are plenty of other churches right around him that are in the same situation. Half of those people are going to be a bit older. What should he do?
Yeah. So I think he's doing the right thing already. I mean, he's reaching out to people that he knows in the community. He's thinking about his population. He should be talking to the Metro folks, trying to gather all the information. And I guess what I would say to Reverend Fuzz is that, if he has a group of leaders in his church, his deacons or the deacon body or however they're organized, that's probably the group that I would recommend that he pull together with some of the experts from the community. We've at the state consulted with a number of different groups. We're not making recommendations about close this event or close that event, but we certainly want to provide the information and it's not unreasonable to close things and pause as we see what's going to happen with this, particularly if there's older populations involved. So I think he's doing the right thing to make the decision. We can provide input, but as I said before, and as was mentioned this morning at the press conference, it's a local decision. It's a decision for the stakeholders. So that's what I would say.
You're reluctant to give direct advice. You're reluctant to a church. You're saying it's their responsibility. They should figure out what they're comfortable with. He asked, how long will this last? And I asked that at the top of the show. You don't know. Is that a fair statement?
That's true. I mean, we can base an estimate based on what we've seen in other countries so far, and that's been 4 months or so, going on 4 or 5 months. So I think we should anticipate at least that long, and we'll be watching those other countries and other states that are about a month ahead of us on the West Coast to see how long we expect this to last. And now we think that some of the best ways that we can perhaps shorten the length of time or have a fewer number of cases and hospitalizations and even deaths, again, is focusing on some of those simple ideas like hand washing and cover your cough and staying home when you're sick. But we really think that those are the things that are going to help us in the future. Hey,
Ben,
I'll mention one other thing that Reverend Fuzz said, and he talked about communion and about changing things. And that's something that we want people to be aware of as well. There's something in public health in terms of pandemic planning that are called non-pharmaceutical interventions. So people understand that pharmaceutical means a drug or a vaccine. Well, for COVID-19, there is not a drug or a vaccine. So non-pharmaceutical interventions are things that we can do in our communities, social distancing, and it may be that when they get the input about their church and when they want to stop or pause or start again, they may do some things differently. So they may do communion differently, or they may not meet as frequently, or they may meet with more social distancing.
And I've heard that some churches are doing the offering differently, whereas you normally pass a tray and people put money in. Maybe you have a place up and people can go place money in. There are some things to maybe rethink.
That's right, and there's some good guidance from CDC about that too, that we're pushing out that we think people can do differently that would help prevent transmission of this disease.
Thank you, Reverend Fuzz. Thank you. Let's go to Ann. Hello, Ann?
Yes.
Go right ahead.
There is a large population of uninsured, and you're constantly hearing not to go to the emergency room, to call your primary care physician, your regular doctor, and your uninsured person is not going to have that doctor to call, and they are not going to be able to afford to go to the walk-in clinic. Why are you not telling these people where to go? Why is that not part of everything else we're hearing over and over again? And children are exposed to so many germs and viruses and things that we as adults don't. Their immune system is constantly fighting off other things. Does that have anything to do with the fact that they are not getting this as hard as the elderly population?
Okay, yes. All right, we talked about that. Children aren't seeming to get it as hard as the elderly population, and that's good news. I want to ask about the other question, and she's saying, you did say, all right, go to your primary care physician. What if you don't have a primary care physician? What do you say to the many people that are uninsured?
Yeah. I guess what I would say initially, and this is information we're trying to push out to the community, that there are many people that just have questions about COVID-19. Sometimes we refer to them as the worried well. They may not be sick. There are some information lines that are available, and our PIOs can share that with your viewers. It's currently operated by the Tennessee Poison Control Center. Those are general questions. We definitely don't want the worried well showing up in emergency rooms or being concerned if they have a symptom that's not consistent with COVID-19. For most people that do have a primary care provider, we think they should be interacting with them. That's how the best care can be given. And there are a lot of discussions going on. There were some key stakeholders at the press conference this morning that are dealing with issues around the uninsured and how do we provide care. One mechanism, there are some safety net mechanisms in Tennessee that we're thinking critically about. Our health department infrastructure is one mechanism that people can get care if they don't have a primary care provider.
Okay, all right, thank you for that question. Heather, Raymond, hold on the line. We'll take a break. Be back right after this.